Hello, my name is Matthew Refferty with the last three digits of my student ID 003. In this student project presentation from group SGDB2, we are going to talk about Crohn's disease. Next slide. These are the members of group SGDB2. Next slide.
My name is Putu Sri Dianingsih and my last digit of my student ID is 070 and I'll continue with the background. So inflammatory bowel disease is a chronic and recurrent inflammatory disease that is primarily associated with the intestinal tract. There are two types of IBD, which are Crohn's disease and ulcerative colitis. Crohn's disease is an autoimmune disease that involves many areas of the gastrointestinal, from the esophagus, stomach, small intestine, large intestine, rectum, and anus. Crohn's disease is a multifactorial disease. Many factors contribute to the condition development of Crohn's disease, such as genetics, infection, immune system, environment, and diet. Crohn's disease occurs gradually and may worsen over time. It also can have periods of remission when the symptoms appeared for weeks or years. Crohn's disease should be treated in order to avoid debilitating complications. Patients with Crohn's disease can achieve better results and higher quality of life with early diagnosis and treatment. Therefore, health workers should have in-depth knowledge about Crohn's disease to give appropriate treatment to the patient with Crohn's disease. The next one is problem formulation. So the problem formulation of the student project says what is inflammatory bowel disease and its type, epidemiology, etiology, pathophysiology, signs, symptoms, complication, diagnosis, differential diagnosis, prevention, treatment, management, and prognosis of the Crohn's disease. The next one is general objectives. So the general objectives of the student projects is to deepen the knowledge about the definition and type of IBD, etiology, epidemiology, pathophysiology, signs, symptoms, complication, diagnosis, differential diagnosis, prevention, treatment, management, and the prognosis of Crohn's disease. The next one is specific objectives. So the specific objectives of the student projects is to know about the definition and the type of IBD, etiology, epidemiology, pathophysiology, signs, symptoms, complication, diagnosis, differential diagnosis, prevention, treatment, management, and the prognosis of Crohn's disease. The next one is benefit. So this paper can be used as a source of information to know about IBD, etiology, epidemiology, pathophysiology, sign, symptoms, diagnosis, differential diagnosis, prevention, treatment, management, and the prognosis of Crohn's disease. This paper is expected to increase the knowledge and give more depth understanding about Crohn's disease. The next one will be continued by my friend.
Hello everyone, and doctor, my name is Amelia Saskiana Dewi with last digit 207, and today I will explain about the definition and types of IBD. The defining features of inflammatory bowel disease or IBD is recurrent bouts of gastrointestinal tract inflammation brought on by an aberrant immune response to gut microbiota. People who have a family history of IBD are more likely to be affected by genetics. There appears to be an immune system failure, as well the immune system defends the body against pathogens like bacteria and virus in healthy people. IBD develops may also be influenced by the environmental variables like smoking and nutrition. Crohn's disease and ulcerative colitis are the two primary forms of IBD. Any area that the gastrointestinal tract, from the mouth to the anus, can be infected by Crohn's disease. The section of the small intestine that comes before the big intestines or colon is often affected. Patches or damaged tissue next to healthy tissue are common. The GI tract's wall have numerous layers, and inflammation may penetrate them. Both the rectum and the big intestine are affected by ulcerative colitis. Damaged regions are not patchwork, rather, they are continuous, often beginning at the rectum and extending into the colon. Only the deepest layer of the colon's lining has inflammation. And that's all from me. Thank you.
My name is Skylenn Hertanto Tan, and I will continue to discuss about the etiology. So the etiology of Crohn's disease involves a multifaceted interplay of genetic predisposition, immune dysregulation, and environmental triggers. So the genetic predisposition plays a significant role in the development of Crohn's disease. Research suggests that genetic factors can increase an individual's susceptibility to the disease. Although they do not directly cause it, the genetic component is thought to influence the immune system response to environmental triggers, leading to the onset of Crohn's disease. This genetic predisposition can be influenced by multiple genetic variants and is often associated with other autoimmune disease. Next, about the environmental triggers, it is also crucial in the development of Crohn's disease. These triggers can include factors such as diet, stress, and exposure to certain medications or chemicals. The exact mechanism of which these triggers contribute to the onset of Crohn's disease are not fully understood, but are thought to involve disruptions in the gut microbiome. The gut microbiome in Crohn's disease is characterized by a dysbiosis or imbalance of the normal microbial flora. This imbalance is often marked by an overgrowth of pathogenic bacteria and a decrease in beneficial bacteria such as Faecalibacterium prausnitzii. The dysbiosis in Crohn's disease is thought to contribute to the chronic inflammation and immune dysregulation seen in the disease. And about the immune dysregulation, it is another key component of the etiology of Crohn's disease. The immune system plays a crucial role in maintaining homeostasis in the gut, and the disruptions in the system can lead to the onset of Crohn's disease. The immune system responds to environmental triggers, and the gut microbiome can lead to chronic inflammation and tissue damage. So in conclusion, the exact cause of Crohn's disease is unknown. The process is complex and involving genetic predisposition, environmental triggers, immune dysregulation, and gut microbiome. Maybe that's all from me. Thank you.
Hello, my name is Bernard with the last three digit of my student number is 103. On this part, I will talk about the epidemiology of Crohn's disease. So, Crohn's disease exhibits varying prevalence and incidence worldwide, with the highest rates of Crohn's disease found in the developed regions such as North America and Northern Europe. In contrast, Asia, Africa, and South America report lower prevalence. However, developing countries have seen a rise in Crohn's disease incidence due to lifestyle and environmental changes. Most Crohn's disease cases are diagnosed between ages of 15 up to 35, with a slightly higher incidence in women. Crohn's disease is prevalent in about 319 per 100,000 people in the United States and between 100 and 300 per 100,000 people in Europe. The prevalence of Crohn's disease is also rising globally, including in developing countries, driven by factors like the adoption of a Western diet and changes in the gut microbiome. And there's also several risk factors for Crohn's disease include genetic predisposition, smoking, high fat and high sugar diets, and childhood antibiotic overuse. A family history of inflammatory bowel disease increase the risk of both Crohn's disease. The increasing incidence and prevalence of these conditions highlight the impact of environmental factors and lifestyle changes on global health. That's all from me, thank you.
Hello, my name is Ketut, Omni, Kanya, and Uttami, and my last three digit number is 048, and I will tell you about the pathophysiology of Crohn disease. Crohn disease involves significant immunity and inflammation changes. Its pathogenesis is driven by tissue inflammation from an uncontrolled immune response to bacterial antigens like Pseudomonas or Mycobacterium tuberculosis. Patients with Crohn disease have dysregulated immune system with hyperactive T cells and excessive cytokine production, increasing CD4 T cells and Treg in the mucosa. Cytokines like IL-12 and IL-23 can raise infection risk and alter immune pathways. Inflammation causes immune cells to produce cytokines, stimulating macrophages to release more inflammatory substances, leading to cell tissue death in the gastrointestinal system. Pathogens bypass the epithelium, triggering an immune response and excessive inflammation. Immune cells from granulomas around pathogen, damaging the gut wall and creating ulcers. That's all for me, and the next slide will be presented by my friend.
Please let me introduce myself. My name is Julyvia Gifensius with the last 3-digit registration number 088. I will now explain about the signs and symptoms of Crohn's disease. From the anamnesis, symptoms reported by patients often include mild abdominal pain and cramping that comes and goes, diarrhea, vomiting, flatulence, blood in stools, mouth sores, decreased appetite, unused fistulas, fever, and fatigue. These symptoms are interspersed with weeks to months of asymptomatic periods. Stress, whether physical or emotional, frequently sets off the flare or flare-up symptoms. For the physical examination, first, general assessment is done to see signs of malnutrition like pallor and low weight, and then check the vital signs for temperature, heart rate, and blood pressure, and then abdominal inspection is done, where palpation of the abdomen is done to assess for tenderness, masses, or signs of inflammation. And then rectal examination to assess for perianal diseases such as fistulas, abscesses, or anal fissures, and then skin to assess for erythema nodosum or pyoderma gangrenosum, and then lastly the eyes for episcleritis or uveitis. That's all from me. Thank you.
Now I'm going to talk about complications of Crohn's disease. Complications of Crohn's disease in such patients can manifest in two ways. First is intraintestinal, and second is extraintestinal. Intraintestinal complications, which are complications within the intestines, can range from strictures that can lead to obstruction, fistula, and then abscess, anal fissure, intestinal bleeding, which is a common complication for Crohn's disease patients, and then perforations, malnutritions, and then a severe complications, which is colorectal cancer. And then extra-intestinal complications, which is outside of the intestinal tract. The complications can range from rheumatoid arthritis, ankylosing spondylitis, scleritis, arthritis, erythema nodosum, pyoderma gangrenosum, cholelithiasis, nephrolithiasis, osteoporosis, pulmonary embolism, cirrhosis, multiple sclerosis, and sepsis that can lead to severe infection. That's all from me. Next slide.
Hello, my name is Arani Kusuma, and the last 3 digits of my student ID number is 181. Diagnosis is done through clinical evaluation. First method is by doing a histopathological test. Samples are collected through biopsy. Findings include lamina propria and neutrophilic inflammation, increase of plasma cells, and ulcers. Imaging studies such as X-ray and computed tomography allow direct visualization of internal mucosa and are widely used for pre-operative diagnosis. Some sections that will be observed include upper and lower GI tract, colon, ileum, rectum, and anus. Changes in vascularization and granulation severity, presence of erythema, focal lesions, ulcers, polyps, and narrowing of the mucosa are present. Lastly, SESCD, which stands for Simple Endoscopic Score for Crohn's disease, is utilized to assess the severity of the disease, with score range from 0 to 3, starting from mild to severe. There are some differential diagnoses I mentioned here. The first one is ulcerative colitis, which is a disease that falls under the category of chronic inflammatory bowel disease together with Crohn's disease. The symptoms include abdominal pain, diarrhea, weight loss, and rectal bleeding. The difference between the two are, in ulcerative colitis, changes are limited to colon and rectum, while in Crohn's disease from mouth to anus and is usually more severe. Signs of continuous inflammation from rectum to anus, including erythema and mucosal friability, may indicate ulcerative colitis. Second is terminal ileitis, which involves inflammation of the distal ileum and ileococcal valve. Third is diverticulitis. Patients are often asymptomatic and diagnosis is done by imaging studies and colonoscopy. Last is amoebiasis. It is a parasitic infection caused by Entamoeba histolytica. Typically, diagnosis is done through microscopy of stool samples, but if the result is negative, colonoscopy can be performed. That's all from me. Thank you.
My name is Niputu Dehurmila with last 3 digits of student number 201, and now we'll discuss the prevention of Crohn's disease. So Crohn's disease is a complex etiology that involves immune system dysregulation, environmental variables, and genetic vulnerabilities, making prevention difficult. Nonetheless, a number of methods have been found that might lower the risk or postpone the disease onset, avoiding certain medications like oral contraceptives and NSAIDs. Oral contraceptives and NSAIDs usage have been linked to an increased risk of Crohn's disease. According to meta-analysis, taking oral contraceptives raise the chance of developing Crohn's disease and other inflammatory bowel disease. In similar veins, NSAIDs and Crohn's disease exacerbations have been connected. Early and aggressive therapy for those who have already received a Crohn's disease diagnosis. Early and aggressive therapy with innovative small molecules or biologic medicines can stop the illness from escalating and leading to intestinal problems. The goals of this strategy is to alter the disease natural course and lessen the necessity for surgery and hospital stays. Monitoring biomarkers, a more effective management of Crohn's disease can result from the use of less intrusive biomarkers for early disease activity identification and monitoring. Biomarkers such as fecal calprotectin and lactoferrin have the ability to predict recurrence of inflammatory bowel disease, hence facilitating timely intervention. Although there are no conclusive dietary guidelines for preventing Crohn's disease, leading a healthy lifestyle and avoiding recognized triggers may be beneficial. Although more study is required in this area, several studies indicate that a diet in low processed food and rich in fiber may be advantageous. Medications to stop structure progressions for individuals with pre-existing Crohn's disease, drugs such as pirfenidone and tranilase have demonstrated potential in stopping the development of strictures, a frequent side effect of Crohn's disease. It has been demonstrated that early therapy with anti-tumor necrosis factor or TNF agents improves long-term outcomes in patients with symptomatic structuring Crohn's disease, indicating that prevention of disease progression is possible. Although the complicated etiology of Crohn's disease makes primary prevention difficult, lifestyle change, intensive treatment, and early identification are key components of secondary preventive techniques that can help control the illness and avoid consequences. So that's all the prevention of Crohn's disease. Thank you.
My name is Asweni Pururaswini Astawa and my last 3-digit number is 161. The goal of medical therapy or medication is to induce remission and prevent disease recurrence. Pharmacological therapy of Crohn's disease involves an agent, namely there are 5 groups. Number 1 is aminosalicylate. The way aminosalicylate works is by delivering active components to target tissue. The examples are mesalamine, sulfasalazine, and oxazolazine. Number 2 is corticosteroid. Corticosteroids treat Crohn's disease by inducing active remission so they can reduce inflammation. The examples are cortisone, prednisone, methylprednisolone, etc. Number 3 is immunosuppressive. Immunosuppressive play a role in preventing disease recurrence, controlling GI tract bleeding, and controlling diarrhea. The most common examples are 6-methaxypurine, azathioprine, and methotrexate. Number 4 is antibody. Excessive production of the anti-alpha protein will make our body can control the immune system correctly. Because of that, we need anti-TNF agents such as infliximab, adalimumab, and certolizumab. Number 5 is antibiotics. Antibiotics help in treating fistulas and abscess that arise due to inflammation. The examples such as metronidazole and ciprofloxacin. Thank you.
Hello everyone, my name is Kirana and the last 3 digits of my student ID numbers are 212. So I will be explaining about Crohn's disease's prognosis. So Crohn's disease is typically characterized by periods of remission and relapse. In the first year after diagnosis, the relapse rate approaches 50%, with 10% of patients having a chronic relapsing course. Most patients develop complications that require surgery, and post-operative clinical relapse occurs in a significant proportion. The risk of surgery at 5 years interval after diagnosis is as follows. 5 years after diagnosis, the cumulative probability of having only one surgical procedure is 37%, two or more surgical procedures 12%, and no surgical procedures 51%. 10 years after diagnosis, the cumulative probability of having only one surgical procedure is 39%, two or more surgical procedures 23%, and no surgical procedures 39%. After 15 years after diagnosis, the cumulative probability of having only one surgical procedure is 34%, two or more is 36%, and no surgical procedures 30%. That's all for me. Thank you.
Hi everyone, I'm Ngurah Bagus Bhismaka with my last 3 digit of my student ID is 124, and now I will summarize our literature review about Crohn disease. First is conclusion. Crohn disease is a complex inflammatory bowel disease characterized by chronic inflammation of the gastrointestinal tract. It is a multifactorial disease with contribution from genetic predisposition, immune dysregulation, environmental trigger, and gut microbiome dysregulation. The prevalence of CD varies globally with the highest rate in North America and Europe and lowest in Asia, Africa, and South America. It is typically diagnosed in individuals aged from 15 to 35 years old and is more commonly found in females. The pathophysiology involves an uncontrolled immune response to luminal bacterial antigen, leading to chronic inflammation. The common signs and symptoms include abdominal pain, diarrhea, weight loss, and blood in stools. Crohn disease is diagnosed through a combination of clinical evaluation, histopathological examination, imaging, and endoscopy. Differential diagnoses include ulcerative colitis, terminal ileitis, diverticulitis, and amoebiasis. Primary prevention of Crohn disease is challenging due to its complex etiology, but lifestyle changes, early and aggressive treatments, and monitoring of biomarker can be beneficial. Pharmacological treatments aim to induce remission and prevent disease recurrence using agents such as aminosalicylate, corticosteroid, immunosuppressant, and antibody agents. Crohn disease is typically characterized by period of remission and relapse, and a significant proportion of patients require surgical intervention. Crohn disease is associated with a slight decrease in life expectancy, and many patients develop complications that require surgery. The risk of surgery and the need for multiple surgical procedures increase over time after the initial diagnosis. And lastly, this is our recommendation regarding the future of Crohn disease management. Taking a holistic approach is essential for improving the management of Crohn disease, improving public and healthcare awareness of early signs and symptoms to promote timely diagnosis, adopting personalized and comprehensive treatment plans, exploring preventive strategies, providing patient education and support, and promoting collaborative research can enhance the quality of care and outcomes for individuals living with these complex and chronic conditions.
Here is list of reference when making this student project. Next slide. That is all from our presentation about Crohn's disease. We hope that the viewers can gain a lot of new knowledge from this presentation. We are sorry if we had said something wrong. Thank you for your attention.